Tune into the link every Tuesday for FHP Hafa Health Tips, brought to you by Take Care. Helpful advice about healthy lifestyle choices that will have a big difference in your health from the medical experts at FHP Clinic. FHP Hafa Health Tips on the link every Tuesday is brought to you by Take Care.
So Hafa Day and Buenas, I'm Joan Aguon Charfauros, and this is this week's Hafa Health Tips from our friends over at FHP. Now I have with me, joining me on this call, FHP Cancer Center's hematologist and oncologist, Dr. Zamir Umbrale. Hafa Day, Doc.
Hafa Day, good morning.
Well, thank you so much, first off, for taking the time out of your busy schedule to join us on this call. I actually wanted to touch up on last week's conversation that Dr. Graves had with Jason regarding lung cancer screening and Lung Cancer Awareness Month. And specifically, I wanted to ask you, what are the different types of lung cancer?
Well, broadly, there are two different types. One of them is what we call a small cell lung cancer, and the other one is a non-small cell lung cancer. So these are categorized based on how they look under the microscope, and also depending on certain proteins and sugars they have on their surfaces. Small cell lung cancers are the more aggressive cancers, and typically we find them that they occur exclusively in people who smoke. Non-small cell lung cancers can be seen in smokers as well as non-smokers.
And what are the different treatments used in lung cancer?
So in lung cancer, there's a wide variety of treatment, but broadly speaking, we can break them down into surgical treatments where there is a cancer that is small enough, like a stage 1, 2, or early stage 3 cancers. These can be removed surgically, where usually we send patients off island to major medical centers where they have bigger teams to perform these big surgeries, where they can take a part of the lung, what we call a lobectomy, where they take one lobe of the lung out and certain lymph nodes around them. The other option is to do radiation therapy, or more recently what we call stereotactic surgery, radiosurgery, where the tumor is small enough and the patient is not a good candidate for surgery because they have other medical problems. Then very often the radiation oncologist can deliver specific doses of radiation to the small amount of the tumor if it's a small stage 1 cancer. The other treatments that we have is, and especially stuff is chemotherapies, immunotherapy, and what we call targeted therapy. So chemotherapies are usual medications that we've been using for 60, 70 years, and involve medicines that go into the veins. They have quite a bit of side effects, but they tend to work well. The newer forms of treatment that we have seen in the last 15 years is what we call targeted therapy. So certain patients who are usually not smokers tend to have some mutations that cause these lung cancers. And over the last 15 years, there have been new drugs developed that target some of these specific mutations and kill the cancer cells. And these medications are pills, so patients can take them at home and tend to have very less side effects compared to the old traditional chemotherapy. And we've seen for these medications, patients are living longer, up to 3 to 5 years, when traditionally for somebody with late stage cancer, they could survive maybe a year and a half. We also see these new treatments called immunotherapies, where these are also infusions, and they have these antibodies. These are part of the immune system. So these antibodies are genetically made, and they are infused in patients, and they help in the patients activating their own immune system to recognize cancer cells better. So these treatments also work very well and have less side effects. And we also see patients do very well on these. They have a good quality of life. Even older patients in their 80s, we are able to treat very well and provide them a little longer to live, and also give them good quality of life.
Nice. And I know you touched up on this regarding new lung cancer diagnosis and treatment.
Yeah, so the new diagnosis is, we've had this low-dose CT scan. So these low-dose CT scans have less radiation than a full diagnostic CT scan that we've been using. And these are known to detect lung cancers earlier. So people who have a smoking history have smoked for about 30 pack years, we call. Like, for example, they have smoked a pack of cigarettes every day for 30 years, or they have smoked 2 packets for 15 years. They are qualified to have a low-dose CT scan because they are at the highest risk of developing lung cancer related to smoking. So the guideline is to do the low-dose CT scans once a year, and we've been able to diagnose quite a bit of patients in the early stages because of that. And then they were able to go ahead and go off island for surgeries. Some of them were older, so they couldn't have the large surgery, so they were given stereotactic radiation, where they get a very finite dose to the exact location of the tumor, and they have done very well. And in my field, we have these new immunotherapies and targeted therapies where patients can have treatments without the traditional side effects of nausea, vomiting, hair loss, diarrhea. So patients are living longer, and there are more treatments are coming on every year. So every year we see multiple FDA approvals for different types of cancers, lung cancer also included.
Nice. Doc, is there anything that you wanted to get out to the island community that would that's watching this right now? Is there any advice or tips that you would give out to them?
Certainly. So the most important tip for preventing lung cancer is to stop smoking if you're smoking, avoid secondhand smoke, maintain a good diet, and have a daily exercise. So exercise daily, do not smoke, decrease the intake of sugar, but because that also increases the risk of cardiovascular diseases down the line. But the most important thing for lung cancer prevention is not smoke, because as I said, patients who develop lung cancer and are not smokers tend to do much better than patients who are smokers. So smoking is the #1 killer for lung cancer. So please stop smoking.
Well, thank you so much, Doc, for taking the time out of your schedule again and providing us with very important information, especially, as we have a Lung Cancer Awareness Month, and just making people more aware of the treatments available, that they should go and, #1, stop smoking if they are smoking, and if they feel any kind of changes to their body, to go and get checked up.
Right.
Yeah, but I really appreciate it. And again, thank you for your time, and make sure, to tune in next week for another batch of FHP Hafa Health tips.
Thank you very much.
Tune into the link every Tuesday for FHP Hafa Health Tips, brought to you by Take Care. Helpful advice about healthy lifestyle choices that will have a big difference in your health from the medical experts at FHP Clinic. FHP Hafa Health Tips on the link every Tuesday is brought to you by Take Care.